Welcome to Prime Life. We call it Retirement 2.0. Leave each episode with tips and new ideas to help you navigate retirement in our new age. It's your time. Make it count.
This podcast is for educational purposes only. It is not intended as medical, investment, or financial advice. We do not sponsor or endorse any of the individuals, companies, products, or services featured on this podcast. Any statements or opinions expressed are of the individual who makes them. We hope you enjoy the episode.
Hi, and welcome to another episode of the Prime Life podcast. It's great to be here again, and I have an amazing guest that I'm really excited to share with you. Her name is Tina Baxter. Tina Baxter, welcome to Prime Life podcast.
Thank you. Thank you for having me.
Tina is an advanced practice registered nurse and a board-certified gerontological nurse practitioner, and she's also the owner of Baxter Professional Services, LLC. This part I really love. She's the founder of the Nurse Shark Academy. Can't wait to hear about that, where she coaches nurses to launch and scale their businesses and host the Nurse Shark Academy show. Tina, welcome again to the Prime Life podcast. Please tell our audience a little bit about yourself.
Well, I am, as you said, a nurse practitioner and still clinically practicing, so I still see patients in the practice, but I also have my own business. And one of the things that I love to do is to help other nurses find a way to develop their own skills, develop their own business, and really to own their own seat at the table.
So I'd like to delve a little bit into that, to find their own seat at the table. Like, what was the precipice for that? Like, what did you experience in your own career, or what do you experience currently that you said to yourself, I need to find a way to help other nurses find their seat at the table? Very curious about that.
Well, I had never really thought about being an entrepreneur myself. Even though I was I like to say, an accidental on purpose entrepreneur. I started out teaching CPR classes as a college student because I was broke. And so I even had corporate contracts and didn't even think of it as a business. I just thought of it as a side hustle. So fast forward to the beginning of the recession in 2008, 2009, and I found myself in between jobs. I was working as a nurse practitioner. I was in a practice that we just did not mesh. Sometimes you're in an environment that is not good for you, and I found that environment to be very toxic. So I was without a job on severance, and a friend of mine was starting a business. And she wanted to help people get jobs because this was the recession. And she had taught CNAs before, certified nursing assistants. So that's what she was doing. And she asked me to come on board. And that's how I got started in business and found that I really loved it. I liked the idea of creating something and taking something from its infancy and growing it and seeing what could happen. And then I discovered that I could use my education degree on my own terms, because I'd been an adjunct faculty member, did all the things, right? I've been in management as a nurse. I've done the things. And I realized I didn't like the corporate structure. And so as an entrepreneur, you get to determine how you want to structure your company, how you want it to run, how you want it to work. And so we were able to make our classes flexible for our students so they can continue to work, because I realized, hey, you've got to feed your family, but you also want to move up in your career. So let's work together so that you can be successful. So out of that program, we've had students become nursing home administrators. And now this particular person, our very first student, one of them, he's now a vice president in the system. And so he's moved up the ladder pretty quickly and still maintains his CNA certification, which I love that too. And then I've had physician assistants, nurses, and nurses come out of there. So I've had CNAs go on and become physician assistants and nurses, and one even went to medical school. So it was a great time for me. And because of that, I started getting questions about, well, how can you do this? And how can you do that? And I've always been a curious person. So I was looking for new ways to bring in business to the company. And when that company, right before the beginning of the pandemic in 2020, we decided to close. My two business partners, one was retiring, the other one decided she wanted to focus more on clinical care. So we split and we closed that business. And then I just reopened and launched under my own brand. And because I had other nurses asking me, well, how do you do it? I thought, well, why not turn it into a coaching program? Because this is what I love, is starting businesses. And I thought I can help you make your dreams come true. And then I went too.
Well, I love hearing that. That's pretty amazing. And I think that when you talk to many entrepreneurs, I am a former entrepreneur. I started my career as one in 3 very different businesses, and I reflect on that. And I also know it takes a lot of courage. But what I'm really curious about also, because our listeners are 55 plus, and so through the students and the different CNAs and nurses and whatnot, do you find that you're seeing individuals wanting to practice longer, or like what's a trend that you see? Because I know we have a lot of guests on our show that talk about retiring and then unretiring because they get bored or they actually, quite frankly, need the income. So I would love for you to, if you can, touch a little bit upon that as well.
Well, the interesting thing about our program, we had our youngest student was 16, our oldest student was 65. This was a woman who had been doing the work, as a CNA, oftentimes doing it private duty for people, but she wanted to get a job in an assisted living. She wanted to continue working, and what was keeping her out of being able to do that was having her certification, and it was something that she really, really wanted. She happened to be from Germany, and she had immigrated from Germany to the U.S. and had been here for years, but never had the chance to take the class. So she took our class, and she's wonderful and still continues to work. And that was several years ago. So I still see her about in the community. So you can find your second career if that's what you want, or you can find a different way to do that. I've had nurses or CNAs that were working at the bedside, as on the floor as a CNA, come back to take our QMA program, which is our medication aid program, so they can kind of save their backs. And this is what I tell nurses: just because you can't work physically at the bedside anymore doesn't mean that you can't still be a nurse and you still can't find your passion. There's several nurses that I work with in the Black Nurses Association, and one, she works in public health now. She retired. She was a travel nurse. She did all the stuff. She traveled and everything. But now she works for the Minority Health Coalition. I have another nurse who got her degree in theology after she retired from the hospital, and has been using her nursing degree with her theology degree and has been counseling people. So there's just so many different things that you can do. And then we have our what we like to call our charity person. She goes around and she can sell things like nobody else can. If she's coming through the door, she's got a ticket for some event or charity that she's sponsoring, and she's good at selling. And that's what she does. She's a great fundraiser. So I say, take those skills that you have and lean into them. So, and maybe repurpose them. I didn't know that I would be doing podcasting. I had no idea. And by the way, I am 50 plus. So there we go. I had no idea I was going to be a podcaster. But years ago, when I was in high school and college, I was a radio DJ. And I started working on my podcast, and I've been doing my live show for a while. And I looked up and I said, all those skills that I learned back then, I'm using now. Who knew? I had to fight my mom to take that class. I ran out of classes to take in high school. So it was the only one that fit in my schedule. And my mom worked in public relations at radio stations. and TV stations. And she's like, you're not going into this industry. And so I said, well, it's just so I can fill out my schedule. But I'm so glad that I did, because I learned some valuable skills.
Yeah, I love hearing that story. I think often, as parents, if we're in a career that maybe, I don't know, for whatever reason, we're like, do something different. Do not do what I do for whatever that reason. But I love that story because, you've shared that, skills that you learned back when you're, using them to such great vitality, and also you're inspiring and teaching others. But I am curious about healthcare in general because, it is not easy to study to be a nurse or a CNA or, a nurse practitioner, and I know you have that specialty in gerontology. So can you talk a little bit about, like, what is that process like? What does that path look like?
And we'll get that answer after a brief word from our commercial sponsors.
Nassau is always working harder to be your carrier of choice. We offer insurance products that can help you meet your retirement goals, such as protecting your savings, securing lifetime income, or paying for healthcare costs. We're dedicated to providing best-in-class service and are keeping things simple, and we'll have your back. We have around 400,000 policyholders and contract holders and have been doing this for a long time, 170 years, but we remain humble enough to always try to improve. For more information, visit nfg.com. Nassau insurance products are issued by Nassau Life and Annuity Company of Hartford, Connecticut, Nassau Life Insurance Company, East Greenbush, New York, or Nassau Life Insurance Company of Kansas, Overland Park, Kansas. Subsidiaries of Nassau Financial Group. Products are not available in all areas. Policyholder counts are for all Nassau companies as of September 30th, 2022, and are subject to change.
Well, I can tell you about my path. My path started as a high school student working in the lab as a tech. And I love science. I was always into medicine and science. And I realized I don't want to do lab. That was boring. It was the same thing every day. No offense to the lab personnel. There are certain people that like that. There's certain people, like my dad worked in a factory all of his life. My dad was very good at that. That's what he liked to do. I, on the other hand, would find that very boring. So I recognized in myself that I needed something different. So I started out with the idea that I was going to go to medical school. I got a degree in biology and decided I didn't want to do that because I saw how I have a lot of doctors in my family. So I got to see how they lived. They were always on call, never had any time for their families or for themselves, had all the toys but couldn't play with them. I thought, I don't want to do that either. So I got a job and trained to be a CNA working in a nursing home because they paid you to learn. I was like, perfect. Teach me how to be a CNA. And I thought, if later on I want to go to medical school, it's still there. So I saw what the nurses did and I thought, I can do that. So I called up the university and I said, hey, let me into your nursing program. And they did. By the way, this was 3 weeks before the semester started. I don't recommend that for anyone to do that. That was definitely a divine intervention. And the fact that I was a transfer student with a degree practically in biology, all I had to do was transfer back to 2 classes and I was done with that degree. So I did finish. I do have a degree in biology. And from there, I just started to say yes to things and to learn new things. And that's how I became a nurse practitioner. Again, my idea is that just start where you are. So if you're interested in starting in nursing or medicine or anything, and you're not sure if you're going to like it, start as a CNA. And I say that because you can get in, get trained really quickly, and start making money. And you can figure out pretty quickly if you don't like blood or any of the other body fluids that you have to come in contact with, or you're not really cut out for patient care, you'll figure that out quickly. And then you can switch and pivot to something else. And you don't have to spend a lot of money investing in a career that you don't want. I had a couple of classmates in nursing school who really figured out after bed making class and struggling through bed making that nursing wasn't for her. So she switched to social work and she was a lot happier. So find out, give it a try. Find the easiest way to get in. CNA is a great way to get into the door because you can get hired in, and oftentimes agencies, facilities will give you scholarships to go back to become a nurse if that's your ultimate goal, and you get a little bit of experience. And then when you're working in the nursing home or in the hospital as a tech, you get a lot more experience, and then you have the opportunity to get into some of those prime nursing jobs because they already know how you work, so they'll hire you from within a lot quicker. So that's what I tell the students. I said, if you can get a job even as a nursing student working in the hospital or the nursing home, do that, because then you can work some nights, get some experience. The nurses are great. A lot of them will teach you some things that you won't necessarily get in school, so you'll get to learn some things and get more experience. And that's what I did, and I had great mentors when I went through nursing school. Those are the ones I still talk to today.
No, I love that story, and mentors are so important. So, Tina, what I'm going to share with you today and our listeners, and not lots of people know this about me, I started my academic career in nursing. I did 3 years, and my husband and I got married while I was in school. We had a fitness center, and I ended up finishing my degree in nutrition, and I loved the work that I did in nursing. I was doing the academic as well as the clinical work. But I can tell you that it is a lot of work, and it's interesting. You mentioned biology, and I love the science classes, but it certainly is a lot to know. And it is very rewarding. And I agree that, I like how you're kind of approaching it with like, here's the entry point. And I love that you're sharing with our listeners, the opportunities that are out there. But I want to switch gears a little bit because you are an entrepreneur, and I'm hearing so much in your voice that you keep talking about perseverance, and you're talking about, there's more than one way to approach things. And you obviously are very resilient and, again, persistent. So I'd love for you to talk a little bit about that piece of it in terms of this type of career, and also just being an entrepreneur. And perhaps you can share a couple successes and also challenges that you have faced.
Well, I'd like to start with one of the challenges. One of the biggest challenges that I had was in my mindset. Because again, remember, I never started wanting to be an entrepreneur. I just originally, I went to my friend and said, hey, you've got this office space. Can I lease a room from you so that I can write a book? That's what I wanted. I had this time off from work. I was on severance. I was looking for a new job. And at that period in my life, I was really beat up. The place that I left was very toxic. It was my first, as my friend liked to call it, my first real nurse practitioner job. And as we affectionately now call it, boot camp. Yeah. And so this practice just wasn't, it just didn't sit well. There's some things that they were doing that I just did not agree with ethically. And so I was in between jobs and really upset that I felt like I failed because I wasn't successful at this job. But I did learn a lot there. And so when I started as an entrepreneur, I was also rebuilding my confidence. And sometimes, having to say to someone, yeah, I got fired. And the reason why I got fired is because I refused to cut corners. It's kind of hard to say that to people, but I won't get into the stuff that they were doing, but it involved me having to speak with an attorney. Okay. Because I wanted to protect myself. And during that time, there was a lot going on in other states with whistleblowers and things like that. And my attorney wanted me to be a whistleblower, but I told him, I'm going to let God fight my battles because I got to get another job. Because there was no real protection for whistleblowers. Didn't matter though, because years later they had to pay for their sins. So there you go. But I say that to say I really struggled in confidence at that time because I felt like I didn't quite cut it. I thought it was going to be the best position ever, and I was miserable there. So I got another job. Actually, I had 2 jobs. So I took 2 clinical jobs and starting a business at the same time. I don't recommend that, but there you go. And so I ended with 2 job offers. And so I never wanted to feel like that again. So I took both of them. And plus, the other job really needed some help, and I felt bad for them and I wanted to help them out. So I did that. And by the time I got done with all that, I ended up with having 5 jobs at the same time. Again, I don't recommend this and starting a business, but I had a full-time job seeing patients in the nursing home, a part-time job seeing patients in the nursing home in psychiatry, and then a PRN or as needed job seeing or helping out a home care agency, a PRN job helping out hospice, seeing hospice patients. And then I had the business that we were starting. So I had 5 jobs at one time. I don't recommend that for anyone, but through that, what I learned is that I can succeed. I can do things. I can make decisions. I can be in charge. I can take the bull by the horns. And so once I found my footing, then I was able to cut back on some things and let go of some things. And so that's what I say about when I think about resilience in the face of people telling me that you're not good enough, that you're not going to succeed, they don't like you or whatever. How do you come back from that? And that's one of the things that I've learned is that when you stand up for yourself and set up those boundaries, it's important. And then now, I would say one of my biggest successes has been me seeing my students soar. During that time, I also precepted several nurse practitioner students, and I'm seeing them have their own practices. And it's just great to see that. Or knowing that I've touched a patient's life, and now that they're healthy and they're doing well and they're on their medication and they're managing their life and they're no longer in and out of the hospital, I think that is success. And so I kind of define my success about what impact I'm making in the world and with others.
Well, I think it's amazing. And those that are around you are so fortunate because obviously you are in the right field. You are in healthcare. And, if all of our healthcare providers really cared as much as you did, like the world would be a better place. And I know there are a lot of good people out there, but I love how you've also relied on your faith and also, your faith in humanity. And I love that. And I love that you shared the story earlier on that was painful. And I think many folks have gone through that. They just haven't shared that publicly. And so I give you a lot of credit for doing that. And I'm sure, those that will be listening to this particular podcast will feel inspired by that because, as you said earlier, when you feel beaten down from an experience like that, it can really, paralyze you and make you not feel so good about yourself. And it's not really about, what you've experienced, but it's how you take those punches, if you will, and move forward. And obviously you've done that. So we have a little bit more time, and I would love to hear you share a few tips with our listeners. If someone were thinking about either being in healthcare or starting a business like you have, because like you said, you became an entrepreneur almost by accident. You didn't really set out to become one. What kind of tips would you get them? Because when you sit back, you'd say, oh, that's like, eating an elephant. It's so big. There's so many parts to it. So how would you recommend individuals take a look at, becoming an entrepreneur or, again, getting into the healthcare realm where it's like baby steps?
I would say my first thing is I always tell people is to start with the why. Why do you want to go into business? Why do you want to go into healthcare? If you can answer that question, that will help you so much because so many people get into it with the idea of, oh, I just want to make a lot of money. Entrepreneurs, oh, I just want to make a lot of money. Okay, but you can do anything and make a lot of money. What's going to make you happy? What do you love to do? And then what skills do you already possess and how can you build with that? My philosophy is for nursing, you don't have to leave your profession. You can leave your job, but you don't have to leave your profession. And so it's like, take those skills with you wherever you go. And so one of the things that I looked at a business early on and as an entrepreneur, and there's a lice removal business. Okay. This is taking head lice off. It was a great business model. It was a franchise. It was something that a school nurse had done. I'd heard about her on a podcast and I wanted to do it. I researched it. And this is another key element. Do your homework, do your research. So I researched it. We would have been the third franchise in the state. We were greatly positioned in between the two. So we're right in the middle. This was perfect. Thought about it, um, well-oiled machine. You would make a good return on it, nice investment. And then it came down to the fact that I don't like head lice. I would be miserable every day if I had to go in there and pick out head lice. Okay. I don't care what kind of process they had. I don't care if, the whole idea of it just was like, no. And so why would I go into that business? Yes, I can make a lot of money. Yes, I can be successful at it. But if it's going to make me miserable at the end of the day, why do it? And so I recognized that's when I had an epiphany. I don't want to do this business. But if somebody else wants to open up a lice removal business and you're a school nurse and this is your jam and you do this all day and you don't care, holler at me. I'll help you do that because that may be the business for you. And that's when the light bulb went off for me. I looked at what really makes me happy. And to be perfectly honest with you, what makes me happy is to see other people succeed and to know that I had a part in it. And so I thought, well, it would make sense then if I don't want to do this business to help someone else do the business. It's the same thing with home care. I liked working in home care. I know a lot of nurses that love to start home care agencies, but if you don't love what you're doing, why are you doing it? And if you're going to be an entrepreneur, you better love what you do because you're going to have some ups and downs in your business. Things aren't going to go well. You're going to have some triumphs, and then immediately you're going to have something happening, a fly in your ointment or whatever that's going to bring you back to earth, right? This always happens. There's cycles in business, just like there's cycles in life. And so in order to weather the storm, you better love what you do. On my elementary school grade card, it said, Tina's an excellent student, but she talks too much. What do I do for a living? I work in psychiatry and older adults where talking is very much a part of it. And I'm a podcaster. So, I leaned into my natural inclinations. You may have a love for food. Maybe you want to open up a restaurant or maybe a catering business. Find out what makes you happy. And particularly if you're in the second half of your life, right? And you're wanting to switch careers, what do you like to do? So I know a lady and she's a great crafter. And what she does is she makes these wonderful handmade ornaments and things like that. And she goes and sells them. She's not able to do what she used to do, but she can do that and she finds her fulfillment there. So I say start with why, and then look at what skills you have, and then build from there.
I love that, and it makes total sense to me. I think you hit upon something very important, which is, oh, I'm going to be an entrepreneur, I'm going to make a lot of money. But if you don't like what you think you're going to be doing, then, I love what you said, because then it's going to be hard to weather the storms, because we know as an entrepreneur, you will have your highs and your lows. And so you better love what you do. And so I love that you shared that. So I appreciate that. So as we're coming down to the last few minutes, Tina, we ask all of our guests this question. So Tina, you have an amazing career. You've done a lot of interesting things. And I love how you pulled back and talked about your grade school card. I had a similar card, a talk too much. But I really would love to know, what's your why? You get up every day and you could do so many different things, but you choose this. What's your why?
I genuinely love what I do. I really do. Whether I'm tinkering with my website or putting up a new blog post or working on a legal case I do that as well, work on legal cases for attorneys. I genuinely love what I do. And so for me, sometimes it's not work. It's like, I don't know. I come in and I'll get going. My old office, before I moved to our new location, didn't have any windows. And so I would never know what time it was. and so I'm working one night and it's like 10:30, and I'm thinking, okay, I'm going to leave soon. I just want to finish this last little project, et cetera, et cetera. So I get started on that. I finish it up, and then I find something else on my desk and say, oh, I need to do this before I go. Before I know it, I get a phone call from my husband, who worked second shift, and he had come home. It's about 2 a.m. and he calls me and goes, where are you? Oh, I said, I'm at the office. I'll be leaving in a few minutes. I just wanted to finish this last little thing. He said, you do know it's 2:00 in the morning, right? You have to go to work to your day job at 8. And I'm like, I had no idea. Time really got away from me. And it's because I was so in the zone. I love what I do. I love talking to people. So for me, sometimes it's not work. It's fun. If it's not fun, then I'm not going to do it for long. I'm going to tell you that right now. That's why I didn't last in management. It was not fun for me. In fact, I discovered it was affecting me mentally and physically. And so I had to let that go. And then I thought I would be the person that would be in academia, because I really wanted to teach. And I found that it was too constricting. It wasn't fun for me, which is why I didn't go to medical school. I took the MCAT twice. I was prepared to go. I just couldn't put the application in because they sucked all the life out of it and it wasn't fun anymore. But nursing is so versatile that I can do different things. And for me, it's fun. And I just love what I do. I'm the person that I told them, you will bury me in my nursing uniform with my Red Cross pin. Yes, that's how I want to be buried. I've always just enjoyed being in the field. Now, do I have days where I'm just like, couldn't I just go back to be a staff nurse and not have to make the big decisions and tell someone they're dying from their cancer? Yes, I sometimes there's days like that. Are there days where I just want to hang up my hat and move on and go sit on the beach somewhere? Of course. But when it comes down to it, I know that I can make a difference in somebody's life. And for that reason, I keep doing what I do.
Oh, I love that answer. So, Tina, if someone wants to get a hold of you, if they're interested in learning more about what you do and perhaps seek your advice, what's the best way to get in touch with you?
They can go to my website, the nursesharkacademy.biz, and they can always find us there. You can send in a request form or email me from there, the nursesharkacademy.biz, or you can follow me on social media because I'm on all the major platforms.
That sounds great. That's great. And we'll post those in our show notes. And again, Tina, I want to thank you for spending some time with me today. I've learned a lot, more than I knew about the different options in healthcare. And I really enjoyed learning about your Shark Academy and all the wonderful impact you're having on so many individuals that will be forever grateful, I am sure. So thank you for joining me again today. And for our listeners, give us your feedback, like us, follow us, and we look forward to visiting with you again next week on another episode of the Prime Life Podcast. Thank you so much.
Thank you.
Remember to subscribe to the Prime Life Podcast anywhere you find podcasts. You can find all of our episodes, contact information, and more on our website, primelifepodcast.com. Stay connected with us. Follow us on LinkedIn, Instagram, Facebook, and TikTok.